Next, I would like to welcome Mr. Steve Dimopoulous, the MP from the Victorian Government. We're very lucky to have someone with us today from the government who can listen to all of our ideas and learn with us. He's a member for Oakley, the Parliament Secretary to the Premier, and the Parliament Secretary for Mental Health, with an opening address. Thank you, Steve.
Good morning. Apologies. So first of all, apologies for the delay. It's a pleasure to be here at this very important conference. I just wanted to first acknowledge the First People and traditional custodians of the lands on which each of us is standing, wherever we may be. I want to pay my respects to their elders past, present and emerging, and to any elders joining us here today and representatives of the world's longest continuing culture. I'd also like to recognise anyone on this call with a lived experience of trauma, neurodiversity, mental ill health and substance use or addiction, and their families, carers and supporters, as well as the clinical and non-clinical workforces that support people with lived experience. I want to acknowledge our hosts, La Trobe University, Professor John Dewar, AO, Vice Chancellor and President. I want to acknowledge Dr. Darren Headley, Senior Research Fellow, Autism Research Centre, and the other speakers today, Dr. Maddox, I think you may have already announced them, but Professor Robinson and Professor Batteram. I want to thank you for your leadership in this space, but more so for the continued guidance you're able to offer our system through your dedicated research. And it is world leading. The process of reform in this area has been long and it's ongoing, but our faith in it is anchored in the relationships we have developed through this review process. Victoria's Royal Commission into the mental health system might just be the most extensive in the state's history. The Commission engaged in 2 years of detailed consultation, which included 61 sessions in 21 locations across Victoria with over 1,600 stakeholders, 12,500 contributions from individuals and organisations, the most public submissions of any inquiry in Victoria's history. An additional 3,000 surveyed, 100 working groups and 8 formal panel hearings. I want to share three of the many stories that came from that process and that submission process, just to help frame our response. So one respondent or one submitter was a man called Rick, a support worker, and he said, in part, for me, at the point at which I had lost all hope and saw no future for myself, if a peer worker had said to me, actually, I was in your shoes 20 years ago and I had no hope and I never thought I would have a job or a partner, and I do have these things now, I think my recovery may have been begun sooner. And from a mum trying to navigate the system, she said, as a single mother who had to work full time to keep a roof over my head and my girls' heads, navigating the service system has been so difficult. This has taken a huge emotional and financial toll on me, as I have not been able to progress my career due to my caring requirements, which will severely impact the amount of super I have to retire on. Disconnected, poorly promoted services with overly tight eligibility criteria meant that only some aspects of my girls' multiple and complex needs could be addressed. And finally, from Amelia Morris, a Victorian who sought help from the existing system. And in fact, Amelia was at the launch of the Commission's report on the 2nd of March this year. She said, one of the main problems I encountered with the mental health system was that when I asked for help, it felt like there was nothing there. The narrative around mental health seems to repeat the same message. Don't be afraid to ask for help. The problem comes when you ask, there doesn't appear to be any answer. It's so heartbreaking when you finally work up the courage to voice the horrible things that you're experiencing, but there's nothing there to help you. What's significant about these testimonies is that it shows that the work we have to do as a community, as research partners, as government, the system was isolating many, many people. It was too complex. It didn't provide enough support. And there were too many mainstream kind of service systems within the entire system that didn't cater for the individuality of each person's experience. And this is despite the hard work and the passion and commitment of the staff in the system. The Royal Commission told us that people with lived experience were ignored, demand had overtaken capacity, community-based services were undersupplied, there was an over-reliance on medication, a missing middle had emerged, people who had needs that are too complex to be supported through primary care alone, but not severe enough to meet strict criteria for entry into specialist mental health services. The system was driven by crisis, responding to the most acuity, the highest level of acuity. Services were poorly integrated. Families, carers, supporters were left without help. There was limited focus on early intervention. Young people adversely affected. There were substantial service gaps for older Victorians, and culturally safe services were not always available for First Nations communities, CALD, LGBTIQ+, and other Victorians. In short, the mental health system was unable to manage the scale of mental illness in the state, and at times did more harm to those who sought help and the people who loved them. Our workforce was overstretched, our institutions were underfunded, and families were left feeling isolated and unsupported. The Royal Commission recommended 65 recommendations on top of the interim report's 9 recommendations, so a total of 74 recommendations. And we made $3.8 billion available in the budget of this year, 20 May. And to give you a sense of that, 3.8 billion, if you take the contributions of all state governments in Australia and the federal government, and to tally them up, it still doesn't equal the contribution in the budget the Victorian government made in May this year to implement all 74 recommendations of the Royal Commission. And of course, it's not going to happen overnight, even with that significant investment. We consider it a 10-year reform journey. We're designing a new system to place the expertise of people with lived experience at the centre of the care provided, consumers, carers, families, supporters. It will prioritise accessibility, ensuring Victorians from all backgrounds and circumstances can access appropriate treatment, care and support if and when they need it. These reforms are ambitious. We are talking a decade of funding, as I said, to support a decade of reforms. We face a number of challenges that are beyond just the scope of what government can control. And so our collaboration with La Trobe Uni and with other research partners and other service providers, non-government organisations, and a bunch of other players and contributors in civil society, including the workforce, is central in us being able to deliver these reforms. It's all about collaboration. It hasn't worked without collaboration in the past, and it won't work without collaboration in the future. So we're doing a lot, and it's hard to get through the scope of it, but effectively, just in summary, based on the recommendations, it'll be a new community-based service at its core, early treatment in the community rather than late in hospital, services that are responsive, good mental health where people live, work and learn. We understand that mental ill health doesn't just materialise in a clinical setting or in a hospital. It materialises, it starts in the community, in families, in schools, in workplaces, in sporting clubs. So central to this is getting our engagement approach right. We are actively seeking and encouraging representation from people from culturally and linguistically diverse backgrounds, people with neurodiversities, disabilities and LGBTIQ+ Victorians. Through our Engage Victoria platform, there are continued opportunities for community participation in shaping the new system, and we're continuing our dialogue with stakeholders, providing regular updates as we deliver these vital reforms. We've designed the systems, new infrastructure around these parameters. 2 parallel systems, one for infants, children and young people, one of the only jurisdictions in the world to have 2 parallel systems, one for adults, one for young people. We will establish up to 60 new local mental health and wellbeing services for adults and older adults across Victoria, a system for infants, children and young people with 13 area services for that cohort across the state. 8 regional mental health and wellbeing boards will be responsible for planning and commissioning mental health and wellbeing services across Victoria, so they're responsive to their regions and their communities. 8 family and carer-led centres will be established across Victoria, adequate funding to support and retain mental health and wellbeing workers, an entire workforce strategy to be developed by the end of this year, so coming out very shortly. And as I said, $3.8 billion just in this year's budget. In the interim, there's a big service gap, and things won't be fixed overnight. So we've obviously, over the last 2 years with the impacts of COVID, invested over 200 million in top-up services, effectively including some pop-up clinics announced about 2 months ago across Victoria to support people doing it tough over the last couple of years effectively. This funding is for immediate assistance, and it's critically important because while we're talking about a 10-year reform journey, people have needs right now. So a part of that pop-up announcement a couple of months ago will allow 90 dedicated clinicians to provide 93,000 additional hours of wellbeing checks and counselling support. So these services are available right now, and of course we've got a whole range of other services, as some of you may be aware, through the family violence reforms and the Orange Door service. So we're committed to doing a lot of work in this area, both in a budgetary capacity but also in a collaborative way. We're also committed to ensuring we build a system that is welcoming to neurodiverse Victorians. There is funding to ensure there are autism spectrum disorder coordinators in each of the child and adolescent mental health services. The ASDs, the Autism Spectrum Disorder Coordinators, facilitate assessment and diagnosis, oversee early intervention and ongoing care, and facilitate referral pathways to other services. The coordinators link with key service providers in the local areas, such as disability services, early childhood services, paediatricians, and others. The 2019-20 budget saw a one-off $2 million support disability output support for the Victorian Autism Plan, and this funding will provide a range of the things I've talked about, including extra capacity in diagnosis and collaboration. For example, part of that will include 475 assessments in child and mental health services across Victoria, in developing an innovative partnership with medical paediatric training programs, the Department of Education, community health centres and private practitioners. Will appoint the ASD specialist role for a senior clinician in 6 adult mental health services and a range of others. In the 2021 budget, so the following year's budget, we addressed an issue experienced in rural and regional Victoria with access to ASD assessment and treatment. There was an increase to all regional child and mental health services and Origin youth services funding to appoint a speech pathologist 2 days a week to support the multidisciplinary autism assessment team. There's a lot more work we need to do, clearly, and part of what we are going to announce shortly is a governance framework for how we collaborate with the partners both in this room but across the mental health and wellbeing service to unlock the reforms and deliver the work of the Royal Commission. We can't do it alone, as I said, and the Minister for Mental Health, James Merlino, will announce as I said, governance model to help achieve collaboration in this space. There's a range of work I could go to, but I just wanted to say to you that you are, as I started this contribution, you are the critical partners in this. There is obviously a high correlation between autism and mental ill health, and there's a range of gaps in the service system that you and the people that you work with would experience every single day. And what you've been successful in achieving both through La Trobe Uni and your partners is raising this as an issue for for government, for the Department of Health, and for the Minister and myself, the understanding that there is a specific need when it comes to autism and mental health and well-being. It is one of those kind of what I pointed earlier before to mainstream services, whether they be in regional Victoria, Metro Melbourne, statewide, or location-based, sometimes miss obvious signs of mental ill health in a correlation with another aspect of someone's medical history or humanity. For example, LGBTIQ+, CALD, women, and in your case, someone with ASD. So they're the kind of issues that we're now grappling with, how to actually create a system that is cognizant of all of those risks and those vulnerabilities, and treat people in the fullness of their humanity and the fullness of their medical history. Thank you so much for the work you do at La Trobe Uni. Thank you so much for the work you do at this excellent centre, which is world leading, and we look forward to continuing to partner with you over the course of delivering these reforms.
Thank you so much, Dee. We really appreciate you joining us today and sharing with us. It's great to hear what the Victorian Government is doing to improve the mental health policy and services for autistic people. I think Victoria is definitely leading the way for the rest of Australia. So thank you so much.